What's up, everybody? It's another episode of the Coaches Compass. Now, remember, I don't know what episode we are on. We're just season 6. We just continue to record to continue to bring on cool guests from all across the world. Now, remember, hit that like, subscribe, comment button down below so you continue to have this thing grow, continue to bring on cool guests from all over the world. I've got another special guest with me here today. I've got Dr. Rachel. Don't even call her a coach. It's Dr. Rachel, a doctor of physical therapy. Coach, thank you and welcome to the Coaches Compass.
Thanks for having me.
So when you first got into this industry, if we look before all the titles, all the certifications, what was something that you were chasing that nobody knew that you were actually after?
I grew up playing sports, and so I think kind of naturally fell into physical therapy, ended up in physical therapy a couple times, from soccer and injuries and things like that. And so I remember being in the clinic and being like, this is cool. Like it felt just fun, right? Like you're out in the gym and every hour is different and every client's different. And I mean, I wanted to go to PT school since eighth grade. I went to a career day with a PT. Like I've always wanted to do that. I've never been able to think about anything else. I actually had a thought the other day. I was like, what would I do if I didn't do PT? No, I really don't. But I got frustrated with PT and that especially with the insurance model, your goal in PT is to get people to where they are like barely functional. And so, especially when you're trying to argue with insurance, right? You get stuck of like, okay, there's rehab and then there's performance. And I would work with a lot of athletes who would get through the rehab part and then not have the performance side of things. And so it was really frustrating to have to like discharge clients before then. And especially again, having been through injuries of my own, thankfully none severe, but just because I can do my ADLs or activities of daily living doesn't mean that I can go back to running or jumping without pain. And so there was just this gap between PT and rehab that I've kind of always known that I wanted to work on closing a little bit. So I do a lot of training now, but that has stemmed from, I guess, my time in sports world.
What's it? How's that gap been though now? Like if you continue to look in the world, right? There's that PT, there's a rehab, there's a return to play before you go back to your strength and conditioning coach. Like how do we bridge that gap and bring it all together? Because also like you talk to, I'm a former athlete myself, right? I've had my serious injuries where I've had surgeries and then even living overseas where they just send you to a PT and it's like, we're just going to get you back to walking. And I'm like, cool. But like, I play a sport that I need contact because I'm playing football. Like I got to be able to sprint, jump, run, like run into another human being, right? You're telling me like, all we're going to do is get me back to walking. Like, bro, I can walk. I'm good with that. But like,
Absolutely.
I need to be able to play. Otherwise, like my career is over. So how do we help, continue to bring it together and also help athletes understand like what they're actually about to go through when they do get these serious industry injuries?
I think a big piece of it is the way that our system works right now is so siloed. So, like, there's physical therapy over here, and then there are like strength and conditioning specialists, performance coaches over here. And there needs to be people that are more in the middle. And if you're on either side, like, let's say you are siloed because you don't feel like you have the background or education or training that you need to get into that other silo, you need to have someone that you trust and are okay talking with so that we don't have, again, point A, point B. There needs to be a bridge between those two. And so sometimes that bridge can be one person, like a PT who is more trained in more performance type tasks. But it could also be if I've got somebody who needs floor plate measurements, I have a guy that I adore who I'll call him and be like, hey, I know that this is what you do. Can I connect you with this person? Right. And so a lot of it for PTs is understanding that, like, we have our role, but if you don't have a training and performance, then you need to be okay and willing to refer out when that client is ready for that. I think, especially when I first started in PT, naturally we want to fix everything. You know what I mean? I want to be the person who gets everybody better. That would be great and amazing. But there is a point, especially if you work in an insurance model, where you need to say, okay, listen, like from the rehab side, we have to discharge you. But that doesn't mean that you're just done. Like in those settings, when I would run out of visits or whatever it is with insurance, I need to have somebody that I'm willing to send you to next and not just saying, okay, discharge, go back to sport when we didn't even do anything in the clinic that involved anything sports related, right? I mean, you're talking about like ACL repairs in facilities that don't have a squat rack, and then you're sending them
You might have bounced on the ACL ball and threw the ball on the
exactly
BOSU and threw the ball off the thing to get your little bounce. So you're ready to play.
that and clamshells. Like clamshells just drive me nuts because I feel like they're just the like go to for rehab professionals because they create a burn. And if you can create a burn, then you think like, okay, well, I'm working some.
They're ready to go. Yeah.
Yeah, and so I think as PTs, we need to be more willing to say like, "Hey, just because you're ready for discharge doesn't mean that you have to be done. Like, I have this professional who I feel comfortable sending you to for the next steps." Now, if the athlete decides not to take that route, then that's on them, right?
Right.
Understanding that we're not fixing everything in the clinic, especially when we're going through the insurance model, understanding what the next step is. And then from the strength and conditioning world, kind of the same thing, right? And I see both sides. Like, you have clients who are in strength and conditioning working on performance, working on tasks, and probably need to be in more rehab, right? So understanding that no one should have all the answers, whether it's PT, strength and conditioning coach, personal trainer, whoever it is, anyone who says that they can fix everything, you should run. Like, major red flag. If they can answer every single question you've ever had, run, major red flag. You need to be okay saying, I don't know. I don't know the answer to that, but I know someone who does, or I'll help you figure it out. And that's, I think, how we'll start to bring those kind of silos together is more relationships and less, I can do it all by myself.
Right. I think that's also an ego thing and a pride thing that a lot of people have. Like, hey, I can do it all, right? I can fix it all because I want everybody. Like even the coaches that say I can prevent injuries. It's like, yo, bro, what do you mean? Like I'm out on the field, so you're gonna tell me like you're gonna stop somebody from hitting me or like a non-contact injury. You're gonna tell me that you can prevent that, right? How hard was it though for you to kind of drop the ego and the pride to be like, hey, like I trust in this person, this coach over here, to help you get to where you need to get to. Even though I've helped you a little bit, right? This person's gonna help you even more because I think that's another hard part that a lot of coaches fear because like who do we trust to send the person to if they're not with us? Because like you said, we want to do it all. We're the one-stop shop.
Totally.
What made you get into it?
I think seeing how much better the results are. You know what I mean? Like when you realize I can't fix everything and that's not bad, right? Like I would work with athletes again when I was in the insurance space and I can't keep going. Like right now, I don't take insurance. So really, people can keep coming as long as they want to keep coming. But at the time, being able to say, like, hey, I've done my part and you need to go to this person now. Like you need to work more on strength. You need to work more on power and explosiveness, being willing to kind of pass that torch and then realizing that that athlete's going to have such a better experience getting back into actual return to play. And it also comes down to realizing that when those athletes come back to you, like let's say that they're in town and they're home for summer and they're like, wow, thank you so much for connecting me with so and so, how grateful they are that they didn't just get like dropped off as opposed to being like, oh, well, I rely on you for everything. It's a good thing to make those connections. And it also establishes trust. I think that transparency of like, I have taken you as far as I can take you in rehab, and now you need to go see a strength and conditioning professional. And I think the same vice versa again for strength and conditioning coaches. Like, hey, my knee's really been bothering me, and nothing that we're doing is really helping. When you have, as a strength and conditioning professional, a rehab professional that you can rely on, hey, can I work with this person while you also work with them? We can work on it together. But there's going to be things that I'm stronger at on the rehab side, and maybe someone else is stronger on strength and conditioning. And so seeing the results that clients and athletes got when I kind of like dropped that wall of thinking I could handle everything, I think made the biggest difference. I also think that the deeper you get into your career, the less ego, which seems like the opposite. You know what I mean? But when you first started, and especially with PT, like that's a 7-year program. So I'm like, I spent 7 years like learning all this stuff, taking all these tests. I can help everybody. I can do everything. You have such a need and a desire to prove yourself that there's that big ego wall. Like, no matter how many PTs you've seen before me, no matter how many times the doctor you said needed surgery, I can fix it. I can fix it. And that after like a little while, you realize, okay, no, I can't. And okay, that's okay. Right. Like, my clients are going to be much happier with me if I say, hey, listen, like this case is not a rehab case. This is a surgery case. Now we can do rehab to make your surgical outcomes better. But I do agree with the surgeon on this one that this is a surgical case, as opposed to saying, I think I could fix it. I don't think we need surgery. Now, are there cases where that's the case? Sure. But you have to be willing and like able to, again, step back. And I think the longer that I do this, the less need I feel to prove myself because I am hoping that my results speak for themselves. And so it gets easier and easier, I think, to drop the ego as I go.
I love it because it sounds like honest talk that you're having with your clients that are coming in and telling them like, hey, like I'm just trying to at the end of the day, it's the athlete first. Right? I'm just trying to help you get back to where you were at before, or even better than what you were at before, which I think a lot of people will struggle at doing because, like you said, the longer you become in this industry, you're like, man, I really have nothing else to prove. My results are speaking for themselves. Like if I have to go outside and find somebody else to help you, like I'll do it. But there's a piece on there that I don't think a lot of people understand when you get into this physical therapy side of thing is that insurance part that you keep talking about, right? What was it like to go from being a place that accepts insurance to going outside and like now not accepting insurance? And sometimes that the price tags get a little heavy for people that can't afford it. So how do you work with those types?
Yeah, that was a big concern for me. I think what happened in insurance world, I spent 7 years in insurance world, and I kinda just got to the point where I was like, I can't not only can I not take care of myself, there's no time to take care of myself, but I can't take care of people, you know what I mean? The reality of insurance world is that insurance is declining with time, meaning that they're paying less and less. So if you look at the numbers per unit, which is go like a time-based unit, so how long a client spends in the clinic, and I go back to 10 years ago when I first started PT, we're getting paid significantly less through insurance than we were 10 years ago, and on top of that, everything is more expensive. So wherever you're at clinic-wise, whoever's running your front desk, you need to pay them more, rent is higher, and so we're getting paid less than we were 10 years ago, which is crazy, but that's how insurance works, and a lot of that is going back to the patient. So that's where these high deductible plans come in of like, "Hey, you've gotta pay $7,000 before your insurance is gonna help you at all." So what started happening for me was, 1, I was having to see like 3 to 4 people an hour for us to keep the lights on at the clinic with insurance.
Golly.
So, honestly, it takes me 15 minutes just to get your history, right? Much less get you in and, like, figure out how to treat this, walk you through it, educate, make sure that you understand it. Form looks good, get my hands on you if I need to, whatever. And so people were having to come, like, 3 times a week, and that's what you see in a lot of PT models is, "Hey, you're gonna come 2 to 3 times a week for the next 6 to 8 weeks." On top of that, a lot of them had high deductibles, and so they were having to still pay hundreds of dollars anyways to come in for those sessions. Coming in, paying $200 and getting seen by a PT for 15 minutes, is not gonna work for anybody, right? And so having to come in, pay that much money for that little time, needing to come in several times a week because of that, what it came down to was when I looked at the, you know, just cash pay model where you just pay for, your time, 30 or 60 minutes. Basically, because I get so long with patients in a one-on-one setting, because most people do 60 minutes, I'm getting you for an hour. There's so much education that happens in that hour. Anything hands-on, cupping, dry needling is included in that time. I really only need to see you once or twice a month, right? And so now I can give you all your stuff to do at home. I'll work on you while you're here. You're not wasting your time coming into the clinic, doing the bike for 10 minutes to warm up, and then you know what I mean? Like, let's be honest.
I know.
That's because your PT is, like, slammed in the back and they need a little time. And so in the cash pay setting, overall plan of care from start to finish is actually cheaper for a lot of people. And so if I like only need to see you 6 sessions over 3 months versus, again, 3 sessions a week for 8 weeks, the timeline stays the same, right? Like it's still going to take about 3 months for most soft tissue type injuries to kind of like turn around. But I'm seeing you so much less. You're not having to take off work to come in 3 times a week. And so from start to finish, the total cost was actually cheaper in the same way that like a lot of times if you go to the pharmacy and pick up a medication, if you say I don't have insurance, they'll suddenly we have a cheaper rate because they have to make profit off of the insurance situation where they're getting paid so little. So it's super, super frustrating. And I mean, it's a sign of where our healthcare is right now. But honestly, being outside of that model, 1, it tends to be cheaper for clients. 2, the care is so much better. 3, my mental health is so much better, which means the care is so much better, right? I'm seeing 6 patients a day instead of 20. I can pour into you. I can reach out. You can ask questions, and I have time to get back to you because I'm not drowning every week. And it's just more simple. You don't have to wait for the bill in the mail to like see how many units were billed and what we did. Like, you know what you're paying up front. There's no questions. And we get more autonomy in that, hey, yeah, you can walk, you can get groceries, you can take a shower, the basics that insurance cares about. But we still have stuff to work on, right? Like you
Yeah.
qualified for a Boston Marathon, you wanna run it next year. Okay, come in, let's do training now, right? We can do rehab-based training or performance-based rehab or whatever we need to do. We're not held by, the neck by the insurance company deciding whether or not they think that that's worth it for you.
Being a former athlete, hearing all this stuff that goes into the back end of what goes on just to get, you know, proper treatment is wild because I mean, when you're an athlete, right, you just go into the training room, right? Like everything is there for you, like at your disposal. But now we're talking about like coming outside of it, right? Like you're no longer in the athlete world, like you're a regular person, like you had an injury, you got to go see somebody. And I didn't know all this stuff went into it. Like when we talk about the insurance play and all that stuff, like golly, it sounds like a headache. And then seeing 20 people in one day, like how do you even get people better like seeing 20 people a day? Like it really there should be a cap on it, right? Like,
There should be.
yeah, yeah. That makes absolutely no sense.
It's something that, I think we are still gonna have to fight. actually, when we moved here, I was going back and forth between like, do I go back to a clinic that accepts insurance and treat patients that way, or do I open my own practice and go cash pay? And I remember telling my husband, like, if things were improving, if I felt like, healthcare was on the right track, I would wanna be a part of that change, like, work in an insurance-based clinic and change things from the inside out. But I've worked in this practice now for 10 years, and it's not better. It's so much worse than it was 10 years ago. And so it is one of those things where I think if enough PTs kinda put their foot down and say, "We're done. Like, I'm not doing this anymore," then eventually insurance will have to kind of, like, listen, but they're, so big and have so much money that that's gonna take a really serious movement. So, if I was hopeful about the change in insurance world, then I probably would have stayed and tried to kind of fight the system from the inside out, but,
Yeah.
I'd be fighting for the rest of my life on that and just, it just wasn't worth it anymore.
It's like the young coaches that I speak to that are just now getting into the industry of strength conditioning that go through that intern GA route, unpaid, all these hours you gotta work. Like, it's that if you they find a way to take a stand and actually come together, like, things would make a change, right? But the unfortunate part is it's almost like even in the NFL or in NBA, the next person coming along is gonna be willing to take that little bit of pay to be able to call themselves say that they're part of that, right? So that's the hardest part about both of our industries and even being former athletes and being athletes, like somebody is willing to come in and do it for less, right? You might not get the same quality, but they're willing to do it for less. And guess what? Fans are still going to show up. Still going to pay to watch the game, even if they don't know that it's not the same. It's not LeBron James out there, right? But there is somebody that's semi equal, right? But if a younger PT were to follow you around, for a week, what is something you think would be surprising to them that they wouldn't see in the textbooks?
I think the biggest thing that I feel clinically is that, like, if you were to just hang out with me for a day, I joke all the time that, like, a lot of my day is just hanging out with people. And the unfortunate part, again, about our system, both in sports and in general healthcare, is that people aren't listened to, right? So, like, they aren't listened to. They are basically relegated to whatever their diagnostic testing says. So, if I've got back pain and my diagnostic testing is normal, then I'm told that I don't have pain. I'm like, yes, I do. And so,
What?
having an hour to sit down with clients, I mean, half my job is listening because no one else has. And so I joke that it's just like hanging out with friends all day, but I mean, it's one on one for an hour. We're sitting down, we're talking. You're telling me symptoms that you didn't have the time to tell your ortho provider or the last PT that you saw. Maybe they were in insurance world, or your personal trainer was kind of like, I don't know about that. That's kind of outside my scope. Let's move on, kind of thing. And so a lot of my day is talking and almost like counseling and educating and decreasing fear of movement, because we've had a big shift, I feel like, on that lately, where it used to be you get injured and, rice, rest, ice, compress, elevate. And now it's the opposite. It's heat and move and all those things. So there's a big education piece. And so a lot of what I do now is talking and education. And yes, a lot of it's hands on, but I tell people that if I've done my job well, one, you don't need me. So you don't need to keep coming back for me to get my hands on you. But two, if I can educate you on what's going on and get you to understand it, then you can go home and empower yourself to do these things. And that is not something where we come through. And again, I think about the old practices I worked at, like run you through a flow sheet of the most basic exercises you've ever seen in your life. That is tailoring your program to you, explaining why this is happening so that you can understand why you're doing these exercises in the first place, because you're not going to be compliant even as an athlete. I don't want to do those exercises if you don't tell me why they're working. Like, I'm not
Heck
interested
no.
in other things I'd rather do. And so much of my day is educating. I think that someone would be fairly surprised about how much of my day is just talking to people. But I think that talking to people and taking the time to do that makes them so much more compliant, and that makes their outcomes so much better. So I think that having the time in this setting to do that is huge.
Yeah, I know the relationship piece and also the why, right? That's the biggest thing that I think that not only your side of the field, my side of the field, but across the board in this whole world, we're missing. Like people don't understand the why behind what we're doing on a day-to-day basis. And you for having you come in here and say that, hey, you're explaining the why and also listening to the people to understand their why on why they showed up, right? Makes everything even better coming to you. But if you fast forward, look, 10 to 15 years from now, look down the line. What do you want people to say about Rachel? Not about how she was as a physical therapist or how she ran her business, but what do you want people to say about Dr. Rachel?
I think that a big, like, take home for me in this field, like, whether it's coaching or rehab, looking on both sides, is I want to feel like I left it better than when I came in. And so that's where it's a really interesting shift that I'm kinda going through right now at this 10-year mark of, like, I'm working directly with patients less and less. Like, I don't see that many clients per week anymore. And a lot of what I do right now is education for future coaches and future PTs. Like, I'll be at the NSCA National Conference this year. I've got a continuing ed course in August for PTs who want to work with athletes from the pelvic health side. So, like, I think I have learned that my direct ability to affect people is going to be limited as I get further and further into this career because again, I see one patient an hour. I've got two kids running around. Like I'm not in the clinic enough to see 80 people a week. And so the best thing that I can do for our career moving forward, whether again it's rehab or coaching, is to teach people so that they can go implement that into their own practices. So I want them to like, let's say again, 10 to 15 years from now, I want them to kind of look at me and think like that was the goal was education so that we can disperse that as many ways as we can. You know, if I teach 10 PTs how to do this bridge between kind of PTs and strength and conditioning or 10 strength and conditioning coaches to kind of do this bridge between PT and each of those 10 people go home and they have 20 clients a week, then that's 200 people that we just affected, right? And that is so much bigger than just, again, going back to the ego discussion, whether or not I had a direct role in their care. When you look at someone's career and you're kind of like, they worked with this athlete and they worked with this elite team and all these things, that's really freaking cool. But how many people did you actually affect that can carry that on? If I try to take on every team and every athlete because I want them on my resume per se, I'm not doing what I should be doing in the field. Like Instagram, especially this question, like I've had a hard time with Instagram because I joke about like I don't want it to be about like clout, right? We're trying to teach people.
Right.
It is a platform where if I do things right, I can teach more people, and that's the goal. So that's what I wanna look back, 10, 15 years and be like, "That's what we did. We taught people, not tried to take the credit for myself, and I'm the best PT in the world, and I'm the best coach in the world, and I wanna teach other people so that they can go implement that so that when I'm long gone, that type of care is still happening."
Love it, coach. That's exactly what this whole thing is about. The whole coaches compass is how do we bridge the gap between whether you're a PT, you're a strength and conditioning coach, you're in the private sector, you're in college, you're in the pros, whatever it may be. Like we all have a journey, we all have a route that we've been going down, but how do we all come together and maybe not all the time talk about education, but how do we get to where we're at? Right? How do we continue to move forward? But how do we continue to move forward if we don't all speak to each other? So, coach, and doctor, thank you so much for your time today. And thank you for keeping it 100 as we went through the coaches compass today. So thank you so much.
Thanks for having me.
And we're out.